Good afternoon, everyone, and welcome to Lasers 101.
This week's episode, we will be learning about lasers and how they're used in cancer treatment.
To recap last week's episode, we talked about light reflection, refraction, and the basics of lasers.
Lasers stands for light amplification by stimulated emission of radiation. Everything is made of atoms, and they each have a different state of excitation.
The level of excitation depends on the amount of energy that is added to the atom, like heat, light, or electricity.
The electron wants to turn back to ground state once it turns into a higher energy level. The energy level is then released as a photon.
A laser is a device that controls the way that energized atoms release photons.
The photons that are emitted have a very specific wavelength.
This wavelength depends on when the photon is released and the electron's energy.
Laser light is different from normal light.
Normal light is released monochromatic. It has one specific wavelength, and each photon moves with the others, making it directional.
Laser light is different because it has a tiny beam that is very strong and concentrated. So, Miss Wagner, what seems to be the problem today?
Well, I have this mark on my arm, and I'm not quite sure what it was, so I was just wondering if you could take a look at it.
So we'll take a look, see. Well, that seems to look like a tumor progressively turning into cancer.
Okay, so what are we going to do?
Well, I will remove that with my laser.
Like laser cancer treatment?
You bet.
Alrighty.
But first, I'm going to run a few tests. See how you're doing. Very good, Courtney.
Perfect.
Now, I will rub some liquid nitrogen on your arm. It will freeze your arm so that you won't feel much during the surgery. Okay, you will feel some slight numbness, and you will lose feeling in your arm at any minute.
Okay.
Now I will give you some anesthesia, and it will put you to sleep, okay? So if you can count backwards from 5 for me.
5, 4, 3, 2, 1.
Okay, now the patient has fallen asleep. I will begin the laser surgery with a carbon dioxide laser. It is the most commonly used cancer treatment laser. Lasers are very good for this type of surgery because it is a very tiny and concentrated beam which will destroy the cells and is very, very accurate. I will use some light reflection to hit areas that I cannot get on. And hopefully the laser will destroy all the cancer cells and not have them come back. Lasers are very, very well used because they do not prone the patient into swelling, scarring, bleeding, and when Courtney wakes up, she will feel a slight irritation, but nothing more than that. She won't even know it. There! The cancerous tumor has been destroyed, and the patient will wake up any minute. Now today we will learn how lasers are used for cancer treatment.
Laser therapy is often given through a tiny tube called an endoscope.
Lasers are used to remove cancer or precancerous growths. Laser treatment is commonly used to treat cancer on the surface of the body or on the lining of the internal organs.
There are 3 common lasers that are used for laser treatment: the carbon dioxide laser, the argon laser, and the neodymium yttrium aluminum garnet laser.
Now we will talk about the advantages and disadvantages of using lasers.
Lasers do less damage to the body.
Patients have less bleeding, pain, swelling, and scarring.
It takes less amount of time in the surgery room and less amount of time to recover from the surgery.
And patients are less prone to infections after the surgery.
There are also some disadvantages about using lasers for cancer treatment.
Surgeons operating using lasers need more extensive training than regular surgeons.
laser therapy is expensive and uses bigger equipment.
The effects of laser surgery may not last as long, which may result in repeat treatment.
To operate a laser in cancer therapy, you will need a medical background such as a doctor or a surgeon, and you will need extensive knowledge on how to operate the lasers.
All in all, lasers are very beneficial when it comes to cancer treatment.
Now, are there any questions from the class about laser cancer treatment?